Clearly, we do see a profound disparity that needs to be addressed aggressively and creatively.
Mayor de Blasio is calling it a profound problem of distrust and hesitancy, particularly in communities of color, about who's getting that first dose of COVID vaccinations. In newly released numbers from the City Health Department, of the 800,000 vaccines already dispensed, 48% went into the arms of white people, even though they represent only 1/3 of the population, 15% to Asian New Yorkers, 15% to Latinos, and the lowest number to blacks, only 11% vaccinated, even though blacks make up almost a quarter of the city's population.
What we see is a particularly pronounced reality of many more people from white communities getting vaccination than folks from Black and Latino communities.
The mayor added several more neighborhoods for what he called vaccine equity, bringing the number up to 33 in all. Governor Cuomo also addressed the issue of vaccine hesitancy.
It has been more of an issue in the Black and the brown community. There's more cynicism, more distrust of the system, Tuskegee experiment, and it's understandable. I don't believe it's justified for this vaccine, but it's understandable historically.
New York City Comptroller Scott Stringer and New York City Public Advocate Jumaane Williams called for immediate action to ensure that all New Yorkers have access to vaccines.
We all know New York City's COVID response left Black and brown New Yorkers to die in far greater numbers and face far greater rates of infection.
Our leaders on every level have really failed the communities, generally speaking, but communities of more color and the most vulnerable communities especially throughout the pandemic.